Good day everyone. I am Jerry George. Me and my group members are presenting a video regarding a patient who is admitted to emergency department with suspected osteomyelitis of his lower left leg, and the doctor is being asked to commence the following antibiotics.
Yeah, sure, you come on.
Okay. You can just. Hi, how are you?
I'm good. How are you?
What is your name?
Tom. My name is Tom.
Okay,
Hi,
Tom.
Tom.
We are the nurses for you today.
Yeah.
My name is Rumia.
And I'm Teja.
Yeah.
We just want to give you an injection. You know
Alright.
that you are having a leg pain because of osteomyelitis.
Yeah.
Suspected osteomyelitis. Okay. And doctor ordered for antibiotic therapy. We are giving one antibiotic through this line.
Yeah.
Is it alright?
Alright.
Okay, thank you. We have. Can you please tell your full name?
My name is Tom Jacob.
Okay. What's your date of birth?
1985.
Okay. Thank you. And this is our medication glucose saline. And here is 500 mg. We have to give in 100 ml for half an hour.
Can I please check the expiry date?
So that everything will be
Alright.
clear.
Okay. And we are giving, you can check this expiry date of this one also.
Yes, right?
Okay.
Yeah. The order is 500 mg. Is it?
Yeah,
4,000.
500 mg, 4,000
Yeah.
this
The rupees
in
also.
100 ml. Rupees also give it.
Find the line.
First I have to.
Alright. So that means it's first.
Yeah, sure.
Okay.
Yeah.
Now I'm going to prime the line. Before that I want to clear the line. Okay.
And we have to set the rate as
So
well.
with the support of this infusion pump, you will get your
Any information, just inform us. You have to just press the buzzer so that we can come and take care of it. Okay?
Yeah, okay.
Don't worry and relax.
Okay. Thank you so much.
Okay.
Okay, bye.
Bye. First we have to put the date, today's date, and we have to write the time.
Yeah. The right patient, the right
Yeah.
patient name.
Yeah. And then already in the
Yeah.
book, we have to check, double check with the and the medication and the route. Everything is we have to write.
Especially the site,
Yeah,
the
yeah.
site of canulation. It's on the
Left,
Right.
left Sapali.
yeah.
Yep. And we have to sign. Can you please
Yeah,
sign?
sure.
on the-
Hello. I'm good.
Is it all right for you?
Yeah.
Is there any pain here?
No.
I want to just make an assessment. That's why. All right.
Yeah.
Do you have any giddiness? Anything?
Nothing.
Nothing. Are you all right?
Yeah. I'm
Okay.
You having leg pain, is it?
Yeah. Severe leg pain.
Alright, don't worry. We are going to administer your antibiotics so that you can get relief.
Okay.
Okay, relax. We are
Thank
going
you.
to take all the medications for you. Just
Alright.
wait. George, if you don't mind, to please take.
What's your name?
My name is Tom Jacob.
Tom Jacob. What's your date of birth?
11/1985.
The
Do you
medication.
got any allergy to medicines?
No.
No, previous allergies,
Not
no.
non-allergy.
Okay.
That's good. This is the doctor order. Flucloxacillin, the vancomycin 500 mg BD
Okay.
IV.
Okay.
This is the injection. You
Okay.
can check for the expiry date
Expiry
as well.
date. Yeah, it's alright.
Yeah. Okay,
Okay.
so our 7 rights has been checked.
Yeah,
All the
okay.
7 rights, and I'm going to take the medications.
Okay.
Josh, this is the
Right.
injection
Yeah,
from the
okay.
lab.
Okay.
Are you happy with that?
Yeah, I'm happy. Alright.
So Tom, we are going to administer as a drip. So it
Yeah.
will take an hour.
Alright,
So
it's too long.
yeah, what to do? It's an antibiotic. We have to administer. It's just for your safety. All right.
Alright.
Yeah. And to get the set the rate.
Yeah. Oh, you already cut it.
Hi Josh, could you please help me with the documentation as well? Yeah.
Okay, ready now.
Yes. This
Okay.
is the injection vancomycin 500 mg IVD.
Yeah.
All right.
Okay.
This is the right patient. The
Yeah.
name Tom.
Yeah, okay.
The rate and the dose is just written here. 20 and
Yeah, the date and everything is fine. The
date,
time.
the time, and the
Yeah.
and also the site
The
of
site.
IV cannulation.
Yeah.
Yeah.
Yeah. Okay. Okay. If any help you need, you just call me.
Yeah,
I'll
sure.
be there.
Yeah,
there
sure.
with the other
Yeah, we
patient.
also have to do the evaluation assessment for the patient for
Okay,
the Tom
sure.
because
Okay.
on the time of evaluation we have to administration we have to evaluate him.
Okay, sure.
Yeah?
Sure.
Okay.
Hello.
Hi, how are you now?
I'm good.
All right.
Yeah, alright.
I just want to do an assessment. I
Alright.
want to make sure that you are all right in between the
Yeah.
infusion. Yeah. I just want to check your cannula.
Alright.
Yeah, it's all right. Yeah. The drip is all right. It's all right. Okay. You are. I hope that you are not feeling any giddiness, any other sorts of any pain or
No,
something.
I don't have any problem.
Okay, that's really good. Just make us inform. Just inform us if you have any problem. Okay.
Okay.
Yeah. Thank you.
Yeah.
Take
Thank
care.
you so much.
Bye. Here I am going to discuss about the assessment of patient for IV infusion therapy. We all know that assessment is one of the important thing that we have to do for any of the procedure, especially in IV antibiotic therapy. It's very important. Before starting the infusion therapy, we have to assess the patient for the complication. We have to check the patient condition, like whether the antibiotic that we have to administer will have no side effects for the patient. So the observation for the patient, the OPS is very important. Check the BP, pulse, temperature, and all the vital signs of the patient before administration. And later on we have to discuss, we have to check the medication. It should be done with another staff member, the RN. We have to double check the doctor's order so that to prevent the further complication. The important thing that we have to make is collect all the equipments for the IV cannulation, make the trolley ready with all the equipments like cannula, needle, injections, and especially the medical order with us.
I am going to continue with the assessment part. And first, during the procedure, we have to assess the procedure, especially which is in aseptic technique. We have to follow all the aseptic technique while administering IV antibiotic. And after the administration, we have assessment part, in which we have to assess the patient as well as the infusion pump. We have to assess the rate what we said before, and we have to assess the tubings, patency of the IV tubings, and we have to, after that we have to assess the patient condition, because we are administering the antibiotic. Sometimes it will cause any allergies to the patient, so we have to monitor the patient frequently. And after that we have to assess the labeling. It is a very important part when we are labeled all the medication on the IV bottle. And after that we have to monitor the patient, and we have to assess the environment, what that all the equipments we cleared. That is the important part of infection control. And we have to teach the client as well, help educate the client about the complication as well as the side effect.
Before commencing procedure, we have to double check with our colleague RN, and we have to explain the condition, and we have to introduce her to the patient, and she can cross examine the resident, so that everything is all right and it's safe for the patient as well as for us, because it affects our registration also. So we should be extra careful. And then if the infusion is not going, the pump will alert us by making noise, so that we can know that what's wrong and we can rectify it as soon as possible.
Hi everyone, I'm here to explain about the complications related to intravenous therapy. As we know, complications related to medical treatment can arise at any time. In order to avoid that medical issues, we as a RN have to be very cautious. As a general thing, 7 hours. These are very crucial in a nurse's daily life. Some of the most common complications seen are hematoma, which is a formation resulting from the infiltration of blood into the tissues at the venipuncture site. The most common sign or symptom seen is discoloration around the venipuncture site. The second will be thrombosis, and a sign or symptom for thrombosis will be fever or malaise. Third one will be phlebitis, which is an inflammation of the vein, and there are 4 different types of phlebitis. One will be mechanical, the second is chemical, bacterial, and post-infusion. The most common sign or symptom seen with phlebitis is redness at the start. The next will be extravasation, which is an advertent administration of a vesicant solution into surrounding tissue. Some of the most common sign or symptoms seen for extravasation is complaint of pain or burning or swelling around the venipuncture site. Venous spasm is the most complicated one. A sudden involuntary contraction of a vein or an artery resulting in temporary cessation of blood flow through a vessel. Sharp pain at the IV site is a common sign or symptom seen. Local infection will be the last complication which is seen in intravenous therapy, which is a microbial contamination of the cannula or infusate. Redness and swelling at the site are the most common sign or symptoms seen.
Job is not finished until proper documentation is done. Under the 7 rights, 7 hours of medication administration, the last hour represent the right documentation. Documentation is most important one, and it's an evidence for which we have administered medication. In documentation, we have the person who have administered medication and the person who accompany with her should sign the drug management chart as well as patient record. It is also important to document on the IV bag regarding the date and time when the fluid is started. As well as it is important to label the IV cannula site with date and time. It is also important to record on the IV fluid balance chart as well as patient record regarding which type of fluid is administered as well as the time which is started. In between assessment is also important thing that should be recorded.